Everybody, welcome. Welcome to this session with Dr. Fishman. It's our pleasure. He is a treasure. I'll introduce him shortly, but before we start, let me kind of set it up. What we're gonna do in this session is I'll start by introducing Dr. Fishman. I'll have a few questions, but this session is all for you guys. If you have any questions, type the question in the chat section. We'll get it. We'll make sure we'll try and get to as many questions as we can. Along the way, you will hear all the stories from Loren, and I'm sure it's going to be a treat. All right, so start with intros and then a few questions, and your questions, if you have, just type them, and we'll wrap it up after answering as many as we can. Sounds good?
Sounds good to me.
Beautiful. So let me start by introducing Loren. We connected with Loren about a year and a half back. We were looking at our users, and we kind of realized that we had a lot of people who came to us. We started as MyYogaTeacher. We served about 190,000 students. But as we were looking through the data, we realized that people are coming to us, a lot of them with pain. And those people really got a lot of benefit from our service, in the sense that they would stick around for a long time and get better and tell us that yoga really helped them. And so as we were looking at the data, we were like, okay, pain it seems like people really want to do yoga when they have pain. So we looked around, and we found, like, okay, the preeminent expert in treating pain with yoga, with all the things that movements and therapy and BK Iyengar's methods you can do. Loren is, the stories he will tell you from his going and meeting BK Iyengar, his time of living in a houseboat in the Dal Lake in Kashmir, or just kind of encounter in front of a bus in a bus station when somebody was falling in front of a bus. So you'll go through all of those episodes as I hope he shares a lot of those stories. What he has done for pain is just incredible. He went personally, learned initially with BK Iyengar the movements, about the anatomy, about what we can do with this. Came back, being a man of science, being a man of very keen intellect. He then set out to prove those methods. He's written 12 books on treating of various kind of ailments with yoga. He's written hundreds of papers in terms of like scoliosis, piriformis, all the ailments that you have related to back. He's been named one of the best doctors by several publications. He's taught at Columbia and actually still actively practices. He is 83 years old. And even now, in one of the meetings I was seeing, we were waiting for other people to join, and I kind of join in, and he is upside down, and he can still do a headstand and be as vibrant as he is. So welcome, Loren. Thank you for taking the time. It's my pleasure to have you join us for the session.
My pleasure too.
Great. Let's get started with talking about pain. What is it about pain which is so hard for the current or the modern medical system to handle, and why is yoga really effective for that?
Well, there are a couple of reasons. I mean, pain is hard for a number of reasons. One reason that pain is hard is that there are pharmaceutical temptations. The doctor sees somebody in his office who's in pain and is tempted to give them opioids, morphine, even stronger ones, Dilaudid, fentanyl. And so that temptation has to be warded off. Pain itself is a very difficult thing. It reduced people like Aristotle and even Buddha to something close to babble. They didn't make much sense about it. It's a very difficult thing. A modern philosopher, Wittgenstein, said, "How can I presume to get between a man and his pain?" And that was not a sexist remark. It applies to women too. Now, the question is, what is it? Well, it's a sensation, that's for sure. And it's something where you know that you've got it and you know where it is. Nobody could say, "I'm in pain," and you ask them, where does it hurt? And they say, "Oh, I don't know." That doesn't make any sense. If they're in pain, they can locate the spot. So now, there are really two basic yoga ways to get rid of your pain. One is, I think, the most favored one, which is to know the anatomy, approach the spot, find the cause of the pain, and remove it. For example, if there is a disc that is pressing in against a nerve, there are yogic positions where you can draw that disc away from the nerve so it doesn't hurt anymore. Perfect common sense. It takes knowledge to know what the cause is and recognize it and then find out what to do about it. But that's very straightforward. The other one is where either you don't know what the cause is and all of your own pains to find out are fruitless, or where you know the cause, but there's nothing you can do about it. For example, the pain that comes from certain kinds of cancer. What do you do then? Well, there is a yogic method that many people have found successful. What you do is, instead of fleeing from the pain and trying to occupy your mind counting sheep or singing songs or do whatever you do, you go into the pain. You say, okay, like a scientist, you say, what is this thing? And you try to understand it. You focus on it. You get closer and closer to it. And sometimes, like approaching a keyhole in a door, the closer you get, the more you see. And you see enough, it's not that the pain goes away, but you can manage it.
That's great, Loren. But one of the things I'm always stuck by, and I see it all the time, is that even though we live in our body all our life, we are very unaware of it. We don't even know much about our muscles, our bones, our vertebrae. As I was going through and learning about this as part of the program that we launched, I was just amazed by how much I didn't know. And I was amazed at how much often blind spot it is for most people. Why is that? How is it that we spend all our time with our body and we know very little about it?
Well, because we're real things. The universe is like that. We should face it. I've been a doctor for more than 50 years, half a century, and you know what? I am amazed by how much I don't know. The body is peculiar, and of course, we live in a civilization. And I mean, most people pay more attention to their face than the whole rest of their bodies. How is if it's a woman, how is my lipstick? What are my earrings like? If it's a man, is my hair well combed? Are my eyes open? What about my beard? And we pay a lot of attention there. And even there, were you to actually dwell on the bones of your face, on the symmetry in your teeth, you would also find untold sources of wonder, perpetual rebirth of wonder on a daily basis. There's just more to it. Like, we're real. We exist in this universe, and the whole universe is like that. It's unknown, and we must do our best. I think a yoga teacher once asked me, how much should I know? And I said to her, if you know how a grasshopper's elbow works, that may help you sometime. There's just, we can flounder and get despondent about how much there is to know. But I think it's better to get going, know what you can.
Beautiful sentiment, Loren. One of the things that compounds this challenge really is that, the pain is there, but there could be multiple causes. There could be multiple things that are going on to cause the pain in the back, for example.
Mhm.
How do it's knowledge, how self-diagnosing, kind of going about this, how do you kind of handle all these complexities?
Well, to go a little bit back to what you asked before, how do you get to know your body? I think yoga is probably not the only way, but it's a really good way to get to know your body, because you're stretching the hamstrings. Well, you feel those hamstrings. And as you stretch them, you get not just associated with their name and their location, but also their properties. How much do they stretch before they start to hurt? How strong are they, as opposed to the muscles such as the quads that do the opposite? The hamstrings bend the knee and the quads straighten them. So you get a feeling for the comparative strength and how they work together sometimes in running, for example. When it comes to knowing, you have 2 or 3 things wrong in your spine, and knowing what's wrong, that's an art. In medical school, they teach you how to make this diagnosis, and they teach you how to make this diagnosis. They don't teach you, well, if you have 2 diagnoses, well, which one is the main cause of the pain? They don't teach you that. That's a form of wisdom you have to put on way later, when you are confronted with someone in terrible pain and several diagnoses, and you want to know, well, what to do.
And there are different things to do with different kinds of pains, right, in the back.
Even sometimes the same pain can have different causes, absolutely indistinguishable from what you see. The same symptoms, but 2 different causes with diametrically opposite treatments. And then you have to figure out what's going on.
Can you give us an example of what you're talking about, Loren?
Yeah, it's a very prominent low back pain example. And people in the group were asking, what's wrong with me? And you can tell by some things. I'll go through it. 2 diagnoses: herniated disc, where there are 2 vertebrae and the disc between is pressing out against a nerve, and spinal stenosis, where the opening in the vertebrae gets so narrow that it begins to compress the nerves inside. So one of them involves the vertical conduit through which the nerves are conducted from the brain down to wherever they're going. And the other one is where the nerves exit the spine at different levels. And there are treatments. Well, first, the symptoms. Symptoms are identical: pain in the back, pain down one leg or both legs, numbness, tingling, weakness, but most of all, pain. And the same pain. So person can tell you their symptoms in great detail, and you still don't know. Is it a herniated disc or is it spinal stenosis? You can't tell. And as I say, the treatments are absolutely opposite. For the herniated disc, arching the back is good, and bending forward is actually dangerous. Bending forward compresses the disc in such a way as to make it actually worse. It can actually make somebody's condition materially worse doing that. So bending back is good and bending forward is bad. Spinal stenosis, same symptoms: tingling, pain down the leg, weakness, back pain, same symptoms. Exactly the opposite. Arching the back is bad, and bending forward, which was so terrible for the herniated disc, is good for spinal stenosis. And I can give you the reasons why that is true, but in the meantime, that very knowledge of their being so opposite in their treatments can help you figure it out. So you can take somebody who says, I have terrible pain, what is the cause? And ask them to arch their backs. And if arching their backs makes them feel better, you say, aha, it's probably a herniated disc. Could it be something else? Oh, it could be, but the odds are high that that's what it is. And if bending back feels bad, you say, well, then very carefully bend forward. You don't want to do too much forward bending because you're worried you might make that herniated disc worse. But if they bend forward a little bit and it hurts more, you say, very likely it's a herniated disc. Could it be something else? Didn't we encounter something with kanji where it was a fracture and bending forward also was bad? Yeah. So then you expand it out and you get more of the history. Spinal stenosis is usually true in older people. Herniated discs usually occur abruptly and in younger people. So that's one way to tell. How did it start? Did it start insidiously, or did it start like a ton of bricks all of a sudden? That will help you. So that's one, I think, really good example of it.
That's great.
Now, I wrote a book about this because in medical school, they don't teach you this. I wrote a book about 3 good examples of this kind of thing, where you can use a certain test called EMG functionally. Instead of just someone lying there in the anatomical position, you can actually test their nerves in one position and then in another position. For this one, you test a reflex, which you can do electrophysiologically, and measure the response in thousands, even 100,000ths of a second, and see if it gets faster when they arch their back, or does it get slower? If it gets slower, you know it's stenosis. Something is pinching the nerve when they extend their back. If it gets faster, you say, well, we helped the herniated disc a little bit. It's a herniated disc.
Yeah, I mean, this is the reason I was asking this question, Loren, is that we actually we speak to a lot of people in pain, and a number of times they say, hey, I went to a yoga class, some of it helped, but I'm not sure if it's working.
Yeah, a yoga class is not the right place. A yoga therapy is the right place for this, because in a yoga class, you're assuming people are normal, and you want, I mean, in fact, even though a yoga therapist is a higher designation, requires more learning and more experience, a yoga teacher really has higher goals. I mean, consider sea level, where you're feeling okay, everything's okay, I'm at sea level, all is well. Well, the yoga therapist takes someone who's below sea level, they've got something wrong, and brings them up to sea level. The yoga teacher takes someone at sea level and takes them over the rainbow. So at the same time, if something is wrong with you, first, let me just advise you, if you're in a yoga class and you've something wrong, tell the teacher. And if you can't tell the teacher, we're making a blog. It's going to be free, but we haven't completed it yet, where you put in your symptoms and tell the blog everything that's wrong. And the blog will tell you what yoga poses you can't do, which you should do, and which won't help you, but you can do them anyway. So it'll tell you the ones you shouldn't do, the ones you can do, and the ones you should do. And it's all done. We just have to get some computer group that can put it online the right way, and then it'll be there. So that will help you too.
I think one of the things we find is that people do yoga, and without that knowledge, a lot of times they're actually kind of doing things that they should be doing, but they are also doing things that they shouldn't be doing. And it hurts them, and they're like, I try not to do this, but then they have this thing that, hey, other people in the class are doing it, and I'm competitive, I want to really do this, I'll push myself, and it's just
that's a difficult situation that I think we've actually talked about enough, so that you guys can probably extrapolate and figure out what to do. I mean, if something is not good, that's nature's way of waving a red flag and saying, don't do that. And if it feels good, generally, Mother Nature is promoting it, is encouraging you to continue. There are exceptions. There are times when you have to get sort of over the top of the hill before it starts to feel good. There are things like that. I suggested to somebody before we started that they do the Setu Bandhasana, the bridge, for 20, 30 seconds, 5, 7 times. And that's not going to be fun at first. But I think even doing it 1 or 2 days in a row with a block between your knees, it's going to really do a lot of good for you. And you'll be glad that you suffered that small amount, which is probably less than the pain causes you to suffer anyway. So another thing is this website that we put it up, but we're putting it up. It's going to be called Yoga Therapedia. Like an encyclopedia of yoga therapy. And I think it might be helpful for a lot of people. It's not up yet. Don't look for it. You won't find it.
Wonderful, Loren. One question from Venu, and everybody, if you guys have questions, please write them out in the chat. We will love to answer them as we go along. Venu, how are you doing? A question from Venu. How does yoga help with lumbar stenosis?
Good question.
I know you talked about it a little bit.
Yeah, I wish I had a vertebra here. Oh, I'm just going to use my cup of tea here.
I have one.
You got one? Oh, well, let's see. Well, maybe you can you show the opening in the vertebra? If you tender touch, show them the open, if you can see it. Well, there's the whole spine, and you can't tell from there, but there is an opening all the way through each vertebra. Thank you. I think that's all we have to show them.
You're right there, right?
Yeah, this is going to be a vertebral body. And then there's another one on top and another one on top of that. And all of them have behind them have a little hoop of bone like this. And it's through that hoop of bone at every level that the nerves traverse the space between your brain and your fingertips, your toes, wherever it's going. Well, when you have spinal stenosis, it's that opening that gets narrow. And there's a particular part of that opening way at the back where there's a ligament called the ligamentum flavum, in Latin, the yellow ligament. And as you get older, that ligament gets thicker and it gets intransigent. It's no longer as elastic as it was when you were younger. And it's one of those perversities of nature. When you arch your back with spinal stenosis, that ligament that goes all the way down the spine bunches up. And here's the perversity. Where does it bunch up? Right where the nerves come out. So that's what hurts. When you stand, you may not realize it, but you're arching your back a bit. Many things during the day, you arch your back. If you lift something heavy, generally you arch your back. That's going to hurt. What yoga does, once you find out the diagnosis, once you know what's wrong, yoga asks you to bend forward with spinal stenosis so that you stretch that ligament. And like a rubber band, as you stretch it, it gets thinner. And if you stretch it enough like a rubber band, it gets longer and slimmer. Yoga has been very successful with spinal stenosis. It's the forward bends. It's the Paschimottanasana. It's the Janushirshasana. These are
Yeah.
Dr. Fishman, sorry to interrupt you, but actually the stuff that you were talking about previously about, disc herniation and stenosis. So unfortunately, I belong in that category. So I've been doing the reverse thing so far, but now that I have stenosis, I can't do the reverse one. And so distinguishing between the pain occurring because of the herniation or stenosis is the challenge. And it's hard for me to figure out which one it is, but that's the one that bothers me the most.
Well, you have to figure it out, but you bring up a very good problem, Venu, because if you have both, as many people do, then if you bend forward for very long to treat your spinal stenosis, you're going to aggravate the herniated disc. That's what you're saying, I think. And if you bend back so much to treat the herniated disc, you're going to aggravate the spinal stenosis. So what do? Well, I think what you do is like what mountain climbers do. Suppose there's a crevice and the mountain climber is at the bottom of the crevice. Then he puts one foot on the left. And then when he gets up a little higher, he puts the other foot on the right. And then he goes back to the left and back to the right. It's called rappelling, I believe. You go from one side to the other, and then the first side, and then the second, and you gradually ascend. So you do, if I were you, I would start with the back bends because it's safer. And arch your back until you feel somewhat better. And then you will know you will be aggravating a pain so that bending forward becomes more painful because you'll be aggravating the spinal stenosis while you're treating the herniated disc. Then gingerly, mindfully, carefully do some forward bending. So you draw the disc back away from the nerve. And pretty soon by doing that, you'll aggravate the spinal stenosis again. But you're not just bouncing from Peter to Paul and back pillar to post. Not just that. You're also gradually treating each condition. But you have to treat them not one at a time, but first one and then the other and then the one. And you recognize that your treatment involves both. Does that help you? I mean, you should get some serious person, someone from MyYogaTeacher to help you with this,
This is exactly what why we launched the Life Tree Health Service, Loren, with Loren, of course, to help everybody who needs this. This is a very one-on-one and a personalized coaching experience that is needed. You need somebody who knows what they're doing. They have a plan, of course, trained by Loren to really help you go through this. So if you guys are looking for help, looking for personalized help, just sign up on on lifetreehealth.com. There's a link from MyYogaTeacher homepage as well that is available, and you'll we'll get you started with the experience to your own plan and your own coaching to get you feeling better.
And we have a wonderful yoga therapist in New York, Paulina Lauterbach. She's actually Chilean, and she doesn't make any bones about where she's from. She's been all over the place, and she's a very good yoga teacher and yoga therapist, and she might be able to help along the way.
She's kind of one who's helping us review all the plans, and you are actually getting direct access to through Paulina to all the wisdom from Loren, and making sure that all our plans are really solid and meant to address and have a plan which would work for you guys. Now, Loren, there are a bunch of other questions as well. I wanted to quickly ask you about somebody in pain. What are their options, and why is, compared to, say, surgery, compared to getting opioids, compared to getting an injection for steroids, what's the topology, and why is yoga and kind of like getting coaching and getting really this kind of therapy a really good option compared to all these?
I think there's so much to be said there. I mean, also, before we go into it too much, this is the weak or. This is like the mother who says to her little boy, do you want to go straight to bed, or do you want to have graham crackers and milk first and then go to bed? That kid is going to bed. The only question is how many things happen before he does so. And the same way with almost all medical illnesses, and certainly pain, you can have more than one. Yoga fits in well with injections. Yoga fits in well with a number of other options. So it isn't either or. It's what can we do to get better, and what's the most effective, and what are the advantages to one thing over another. The advantages to the medicines, they could be oral steroids or non-steroidal anti-inflammatories. There are a host, muscle relaxants. There are all kinds of medicines, and they work. The problems with them are, of course, there are side effects. Sometimes they're expensive. You can't take, some are habit forming. You can't take them forever. Their factories are belching smoke into the atmosphere. Environmentally, they're not so good. And maybe worst of all, they can be habit forming, even if they aren't narcotics. If they are narcotics, they're of course habit forming, but some of the other drugs, even though they're not touted as being habit forming, in fact, people will begin taking them on a chronic basis to stave off pain that doesn't even exist in them at the moment. So what's the point? So that's, I think that said, we can talk about the actual big advantages of yoga. One thing is a study that's been, there've been 50 studies like this. If you do something active, not only do you live longer, you do live longer. It's an average. Even a yogi can be run over by a beer truck on his way to the health food store. It's not that everybody is going to live so much longer, but on the average, your numbers are better. You have a chance of living 3, 4, some people say 7 years longer if you're active. What does that mean? What does it mean active? It means 20, 30, 40 minutes every day or almost every day. So that's one advantage to yoga that the medicines won't give you. The physician just rolls a pill across his desk or her desk. That doesn't make much difference for your exercise. It's not aerobic to pick up the pill and thrust it into your mouth. No. Yoga is active. It's a physical part to yoga. What else is there to yoga? Well, there's the soul and there's the mind. There's the heart. There are by which I mean the emotions. And yoga is known. And there's a recent study by the Yoga Alliance. I sent it to Jitendra yesterday, it just came out, showing that yoga is now the biggest reason people go to yoga now is for emotional calm, to vanquish anxiety. And with pain comes anxiety. It's sort of the right reason to have anxiety when you're in pain. What's the wrong reason? Well, do I have the right shirt on? That's not a good reason. So that's another advantage to yoga that is, it's like a side effect that is positive. There are other side effects that are positive to yoga, whereby you increase your strength, you increase your range of motion, you increase your coordination, all of which deter falls. Your balance is improved, your posture is improved, good for hosts of conditions, from respiratory ills to osteoporosis. What else is good about yoga? Well, it's almost free. You can, if you have a yoga therapist that teaches you how to get out of a certain pain, well, maybe in 5 or 15 years, you get the pain back again. Well, you know the treatment. You can do it yourself. I mean, sometimes you can't, so you go back to the yoga therapist, but often you have learned enough. You can do it at home. All you need for yoga is you. So I think those are some of the terrific. Oh, also, you can bring it into foreign countries. There's no import duty.
That's great. Thank you, Loren, for that. It's a knowledge you get, and you can keep it, and you can actually use it, and it will help you along the way in terms of being aware of what is going on in your body. Okay, I have a question here from Ramanujan. He is asking about scoliosis, and I know you have done extensive study on this. Go ahead and talk about what yoga can do for scoliosis.
Okay, well, yeah, I've done three studies are published. The fourth one is already accepted, but it isn't out yet. And a fifth one I'm doing now, which is, I'll just tell you about it in case you're interested. If you have to come to the United States to do it, I don't know where you are in this world, but in my office, you have to come to my office once. And we're using yoga. It's been very successful. The way we analyze scoliosis, I've got this, a patient gave me this thing I'm going to show you. It's actually it's a cell phone. It's, the other side of it is a cell phone when you do FaceTime with people for a half an hour and you don't want to keep holding your camera. So imagine this is the spine. This isn't straight enough yet. Do what I can to make it straighter. If this is your spine, let me make an analogy. Suppose it's not your spine for a moment. Suppose it's a radio antenna that you see on a drive in the country. Well, what's holding it up, paradoxically, are cables pulling down. A tent pole is the same thing, held up by wires or ropes pulling down. And our spine can be looked at that way. It's a concept of Buckminster Fuller, the architect, and there was another architect, Snelson, who did the same thing. But it's called a tensegrity structure. So now imagine that this side, the cables on this side were pulling down more strongly. They're really pulling. This side, the cables are there. They're not pulling down so strongly. Then you'd expect that the spine would bend this way, bend under the pressure of the cables pulling down. And that's the way we look at the spine. Now, we are not tent poles. We are not radio antenna. We have ribs. And as the spine curves, the ribs splay out according to the radius of curvature. And they spread the soft tissues, the muscles, the skin, and then they migrate back into the space that their separation creates. So that's what you see in people with scoliosis. I don't know, Mr. Question Asker, then do you find that you have a bulge on one side? Probably you do. This is the lumbar spine. Sometimes people don't have much of a bulge. If the curve is low enough, it's below the ribs, and you won't have that. But most people do. Well, anyway, most people do. And for hundreds, maybe even thousands of years, this side is big, it's rotated back, it's stiff. People have thought that this is the strong side. It's big, it's hard. Isn't that what muscles do? Well, it is what muscles do, but this isn't muscles doing it. These are the ribs, bony structures that are brought back there. So anyway, for many, many years, people have considered this the strong side, the convex side. But actually, nothing could be further from the truth. The strong side is the side to which the spine is bent down. It's this side that's the strong side. So now all we do in our yoga, absolutely all we do, is to strengthen this side. And then little by little, it takes months, people's spines come up back to straight. Now lately, we found a lot of people, they get tired of doing the single pose we ask them to do. Even so, they get tired, it's too much for them. Or they want to go faster. So now what we're doing is we're also giving Botox, botulinum injections on the strong side. So we're strengthening the weak side permanently, and we're temporarily inactivating the strong side. So they come up much more quickly. And we've had, honest to goodness, what's the average? Well, the average person gets 10 to 12 degrees better in 3 weeks. Those are the odds. So not everybody gets better. Some, 1 or 2 people have only gotten 2 degrees better. Nobody's gotten worse yet. And the best one was a man who got 27 degrees better in 3 weeks. And then the botulinum toxin wears off in about 6 weeks. So the question is, are they going to go right back to having this curve? The answer is no. Because in the meantime, the yoga has gotten them strong enough on the other side. And the fact that the muscles, this is a little technical, but I'll just go a little into it. The muscles on this side are very stretched. When the spine is like this, the muscles are very stretched. When the spine comes up, the muscles interdigitate more. I mean, this has to do with the way muscles contract. Here we are in 2023, and people really have some question about how muscles contract. But everyone agrees that the fibers have to slide more, and the more they slide together, the stronger they are. So giving those temporary botulinum injections lets the spine get straighter here, lets the fibers interdigitate more, and they're stronger on that basis too. So in 3 months, the average benefit is 16 degrees. So they come up quite a bit, and they seem, so far we have people who've had the botulinum toxin a year ago, and they're still better. So yoga is really good. I'm holding forth a little bit on this one because yoga is really the only sensible alternative that I know to surgery. And the surgery has dominated the field of scoliosis treatment. And it's like 2% of the population. India has more than 1 billion people. So that's, how many is that? 100 million. 100 million people.
It's 20 million.
Well, if it's 2%, it's going to be 20 million.
Yeah.
It doesn't sound right, because in the U.S., but the U.S. they consider it to be more like 3%, 4% of the population. So they come up with 6 to 9 million. So I thought India would be more, but it's not 100 million. No, it's like 10. It's like 10 million if it's 1%. If it's 2%, it's 20 million. 3% would be 30 million people, more than all but a dozen countries in this world. It's a lot of people. Yeah. And the reason it's been dominated by surgery is because no one is ever sure of anything else that works. And they don't do surgery unless you have a curve of about 45 degrees. So most of the people that have a scoliosis at this point have what's called adolescent idiopathic scoliosis. Idiopathic meaning we don't know why it's caused. We don't know what the cause is. Well, I think I do know the cause. It's this muscular imbalance. And treating the muscular imbalance seems to cure it. So I think we are onto something rather big. But there are the parents of these children in their, between 12 and 20. The curve is only 35 degrees. So what do the parents do? Anything they can. We will do for our children what we would never do for ourselves. They get braces. They do the Schroth method. There are all kinds of methods. The chiropractors have methods. And these methods take hours a day, sometimes of agonizingly complex rituals, really, is what they are that you do. And they don't get much better. So the parents are reduced to waiting helplessly, not sure whether they want their darlings to get a curve of 45 degrees so they can have surgery and be done with it, or stay at 35 degrees and escape the terrors of surgery. And what's so wrong with the surgery? Well, they fuse the spine together so that you can no longer twist and turn. You have to turn your entire body in order to turn. Dancing, swimming, volleyball, things that you normally enjoy, you have a lot of trouble with if you can do them at all. So I highly recommend the yoga. I have taught, Jitendra, we have taught the yoga teachers at MyYogaTeacher know this, right?
Yeah, absolutely. Your training has been incredible, and all our teachers are personally trained by Loren in terms of all the methods of. We talked about herniated disc. We talked about stenosis. We talked about scoliosis. These sound very complex. A lot of people come to us, Loren, and they're wanting to. The question they ask is, you really got this nerve pain? Do you really get herniation and disc? Can you really help with this?
Yes.
They're just skeptical. They're like, can this actually be done?
Well, let me tell you a little story about Robin McKenzie. He's a physical therapist from New Zealand. And about 25 years ago, he was off doing something else. He left a patient with a herniated disc in extension for 20, 25 minutes. He had made a mistake. He said, "Oh my God, what have I done?" He went to see the patient. The patient jumped up and said, "Oh my God, what have you done?" The patient was better. So Robin McKenzie, being an intelligent person, said, "I wonder what was going on here." So he tried it with some other people and it worked. And what they've come to believe, and what MRIs and EMGs seem to validate, is that when there are two vertebrae and the disc, this person is facing this way, so the nerve part is behind the vertebral bodies, behind those big cylinders of bone back here. When you arch your back, and the next one is back, so you're arching the back of the person facing this way, then you create a partial vacuum up here in the front between the two vertebrae. And that partial vacuum draws the disc forward and away from the nerve. And if you do that, with some vigor and persistence, it doesn't go back to where it was before. Now, does the disc ever get completely healed? No. Do you get out of pain? Yes. Does it recur? Sometimes it does. Usually it does not. And if it does, you know what to do.
Yeah. But one of the things I was reading this week, Loren, was this article in Wall Street Journal. And there was this very curious thing that a lot of times people look at MRIs and they see that there is a disc issue, but they have no pain. And there are times when they don't see anything, and they have people complaining of a great deal of pain. So it's still like, it's hard to just look at an MRI and say, okay, you know what, there's something there and we got to fix it, rather than, and it might be nothing, right?
Right. Well, the yoga teacher is better than the doctor there. The doctor may treat the imaging study. The yoga person knows to treat the person. And, there are two cases that you bring up, and one of them can be dismissed. If they have no pain, but they have a herniated disc, that happens. The disc is not always painful. As we're saying, if you draw the disc forward a little bit, it doesn't touch the nerve, and there's usually no pain. On the other hand, if there is pain and the MRI is normal, there are many other causes of back pain that are legitimate and rather material in their nature. You can have spinal stenosis, you can have a fracture. There are all these other kinds of back pain you can have. And it's something that they should know about. The MRI is not the be-all and end-all of the back pain diagnosis. But there are cases where you don't see the disc on the MRI, but it is the disc that's causing the pain. I've seen it not often, but I've seen it a couple of times. One was an orthopedic surgeon from Illinois who came to me because he said, well, my MRI is normal. I think I have piriformis syndrome, where the nerve goes through the buttock and goes down the leg. And sometimes there's a muscle there called the piriformis that compresses the nerve. That's what he thought he had. I did the test for that. It was negative. When I looked at him again, and I did this study where I can see which nerves are involved, I said, well, you have all the symptoms of a herniated disc. Let's treat you like you have a herniated disc and see what comes to pass. So we treated him, and he got better. He was very confounded because he's an orthopedic surgeon. He believes in these MRIs. He went back, and 2 months later, he wrote to me, he said, I can't believe it, I'm still better. I wrote to him and said, well, get yourself another MRI. He got another MRI, and it showed up. There was a disc. The MRIs, it's also not entirely, it's only human, you know, it makes mistakes too.
Very cool. So the idea of treating the pain, treating the person is really kind of what you taught us, and I think that's really the whole of the person, taking care of the pain rather than getting very technical about it and fixing everything that shows up in an MRI or an X-ray or something.
Yeah, there's the person and there's the pain, and between the two is the diagnosis. Why is the person feeling the pain? There's a reason. There's a middleman. That's what we have to identify first. Then we can proceed. Yoga has a treatment for almost everything. I mean, all the yoga, with very few exceptions that I know, comes from Mr. Iyengar. And one part of the genius of Mr. Iyengar is that he found poses and he invented them and perfected them, refined them, so that the better you get at the pose, the safer it is, and the better the pose is for you. That's why he works with all these props, because he wanted you to get the pose right. Once you have the pose, it works its magic. And it's not fully magic. You can explain it in terms of Western medicine, that's for sure.
Very cool. Thank you for that, Loren. We have some questions.
Okay.
One question is about hip bursitis. Can this be treated with yoga?
No, it can't. The only thing a very perspicacious yoga teacher can say, well, stop walking that way so you don't give yourself that condition. Don't sit in that kind of chair where you're rubbing against it. It's the greater trochanter. It's a trochanteric bursitis. Let me show you where it is. It's right here. It's where it's the bone, the greater trochanter, comes as close to the surface of the skin as the hip bone ever does, all the way down the leg. It's pretty, there's muscle covering it, or tendons. But here it's just a fraction of an inch below the surface. Maybe it's 5 millimeters. Then you go just behind it, and that's where the greater trochanter is. And if you press there, it will hurt. Now, if it's pain from a herniated disc or spinal stenosis and it hurts down the leg, if you press in that point in the leg, it won't hurt. That's the manifestation of the pain, but the cause is way up here in the spine. If it's a trochanteric bursitis, you press on it, it will hurt. No numbness, no weakness, no paresthesias, pins and needles. There, as far as I'm concerned, the yogi can help you if the yogi's smart, mindful, and experienced, and say, it's a trochanteric bursitis. Now don't sit, whatever, and question you. What have you been doing lately? Did you just climb a mountain? Have you been lying on that side inordinately? Did you get a new chair and you're sitting in it a lot? There are reasons, and they can help you that way. But yoga itself is useless for us. This is an overuse kind of condition. And therefore, what you do is what's wrong. Yeah, so the best treatment that I know is to go to even a local practitioner who can give you a little injection, a very safe injection of a little steroid, which your own body makes, which you need to live. They can make the exact formulation chemically, exactly the same molecule that your own adrenal glands make, and give you an injection, it'll go
away. There is a question about cervical dystonia. I don't know what that.
What is this thing? That's where muscles in the neck get tight and you can't control them. There are all kinds of dystonias. Some come from taking the antipsychotic medications that abounded a decade or so ago, like Haldol. That's one of them. And sometimes it's the lips that get involved. They can't stop doing it. They go like that. And others involve the neck, where the neck gets very stiff off to one side. or is twisted. Wry neck too can do it. And it's difficult. Botulinum toxin is excellent for this in terms of medications, which will soften the muscle. But then 8 weeks later, it may come back again. So it's good to have some yoga to work with the botulinum. It can be very painful. So you do want something immediately. And there, botulinum takes a week to work. You might want a little just a lidocaine, an anesthetic injection, just to inactivate the muscle for a while, and then do the botulinum toxin, and then do the yoga. It's a very painful condition. People are in great distress with it sometimes. And then the yoga involves is stretching that muscle. What good does that do? Well, by stretching it, do something that Jitendra mentioned earlier. You get to know the muscle. You get to be friends with the muscle so that you have greater control over it. Now, the dystonia is generally caused by a place way inside the brain. You're not going to get that familiar with it. The brain itself has no sensory neurons. I mean, when they operate on the brain, they give you anesthetic because of the skin and because of the skull. But once they get into the brain itself, there's no feeling. And so you're not going to be able to feel this place in your brain. You ain't got no feelings there. It's like asking someone to feel from the tips of their hair. No. So what do? Well, when you get to know the muscle, you begin to get a little braver, more, if you don't mind the word, empowered. And you try different. What about that? Does that stretch it? What about this? Going like this, going forward, off to the side, and twisting. It's 3 different dimensions, 3 things. Will that help? Well, you will find things that will be at least temporary cures when it comes up. And it's much better than a medicine that you're taking all the time, and you don't only need it 2 or 3 hours a week when the dystonia occurs. There are many causes for dystonia, but yoga is a very good way to control it.
And we have guys in the Life Tree Health. One of the things we do is we have a consultation session where you come in. You will talk to one of our therapists. It's free of cost. You most likely, Loren was saying, Paulina, there's a good chance you might actually talk to Paulina, and she will kind of evaluate and tell you what we should do and whether we can help you or not. This is so just go to lifetreehealth.com for anybody who might be interested in this, any of you or any friends or family. All right, I have another question, which is back spasms in the lumbar region. So after being sent for an X-ray by my family doctor, it was diagnosed as bone denigration as we age. I'm in the late 50s, and yoga every morning helps me manage that pain as I steer away from painkillers.
Go ahead, Chandra, go ahead.
The question is, maybe the bone degeneration may be inevitable, and I'm saying it's written as denigration, yeah, maybe inevitable as I age. How can I slow it down so as to not get it to a debilitating stage?
Okay, well, a couple of things that could be meant there. One could be that the person has osteoarthritis, and the joints, and there are many joints inside the spine. Every vertebra has 4 joints, 2 below and 2 above. It could be that there's arthritis, and that's what is meant by denigration. Could also be osteoporosis, where the bones themselves are getting thinner and less strong. Now, the osteoporosis, getting thinner and less strong, won't have any appreciable effect on producing back spasm unless there's a fracture, which of course is more likely when you have osteoporosis. But let's just assume that what is meant there by denigration is osteoarthritis. And that means these little joints that are holding the vertebrae apart from each other and allowing the disc to go between them, they're getting swollen. They're real joints, just like the knee. They have fluid in them. They have a capsule. They have a little meniscus. Every one of them is a real joint. We're very complicated. And when they get arthritis, which is not infrequent, then instead of being this big, they get this big. They get swollen. And in the tight specifications of the spinal cord, that often makes them press against the nerves. And that can give you spasm. Or they can get pain on their own, just the way an arthritic knee can give you pain without the benefit of being close to some major nerve. It hurts because the capsules themselves are richly invested with nerves. So what does yoga do there? Well, yoga has a preventive effect and a therapeutic effect. When it comes to yoga, whatever else yoga does, it stretches. And by stretching the capsule and the ligaments and the tendons and the muscles that bridge across any joint, even these tiny little joints in your spine, you prevent arthritis in a number of ways. First, just by giving it more mobility. Secondly, they all have a little fluid in them. And the better you circulate that fluid, the more likely you are to avoid serious arthritis. Where does arthritis come? Well, if you imagine a joint being a square, the arthritis starts in the corners, the places where the fluid is least likely to circulate. You see, the surfaces of a joint don't have any little blood vessels in them. So how do the cells there that make cartilage and retain it, how do they get oxygen and glucose and protein, hormones, and get rid of the products of metabolism? Answer, the fluid in the joint circulates. And the sides of the joint, where there's no weight bearing and no pressure, they have the little blood vessels that give off the oxygen and so on, and take up the products of metabolism. Now with yoga, you circulate that fluid a lot better than you otherwise would. So I think that's one of the principal preventive measures. It's not just primary prevention, stopping you from getting it in the first place. It's also secondary prevention. Once you have it, preventing it from getting worse and helping yourself with pain. What is the pain? Well, the pain comes because these little surfaces that do have nerve endings on them begin to get irritated by each other because there's nothing between them. They're not getting good circulation. So the products of metabolism build up, and some of them are quite toxic, like lactic acid. They accumulate in there, and the yoga helps circulate it, get rid of the lactic acid into the blood vessels, from which it gets expelled through the lungs and through your normal functions. So, okay, so suppose you got arthritis. What do you do then? Well, there are a number of similar and also different yoga things you can do, yoga things. One of them is, pain is on this side, you stretch to the opposite side and open those joints a bit. Another one, and then the other side. And there are many yoga poses that do these. The twisting poses, Parivrita Janu Shirshasana, Parivrita Trikonasana. These are not easy poses. Some of them are tough. Parivrita, almost anything will help you with these. You have to do them gingerly, and you have to do them faithfully every day for a couple of weeks. You start to feel better. Then you continue doing them. You will stave off the major pains and aggravations of arthritis.
Beautiful. That's great, Loren. I know we're going. We're at 9:03. There was one last question I wanted to take before we wrap up. Is chiropractor manipulation safe, or does it give only temp relief? When do you suggest to go for it?
Okay, well, let me go back a little bit, because I was thinking of the last question, and I'm not sure I really answered it fully. Okay, so you got the arthritis and you got the back spasms. What do you do about those? Answer, they are usually the quadratus lumborum muscles. They're usually the muscles over here. And then there is wonderful yoga for them. There's the ones we talked about, the forward bends like Paschimottanasana, which will take both of them. Or if the spasm is really severe, you want to divide and conquer. So you might do Janu Shirshasana on one side and then on the other. Or you might do Parivrita Janu Shirshasana, where you twist like this, stretch this side, preferentially. Then you do it on the other side too. So yoga is good, again, for basically the same reason, because it stretches. When you have spasm, all of these features we've been talking up, the building up of lactic acid occurs in spades. And then the lactic acid makes the muscles irritated, and they get tighter. there's an engineering defect in man and really in all creatures, all mammals anyway, that when do the muscles need oxygen and glucose and everything else? When do they need blood? When they're working. But when they're working, they contract and they cut off the very capillaries that supply the blood. Now, the nature has a way of curing that. It's called rate coding. If this is 4 muscle fibers, this one gets active, and then it begins to get a poor blood supply. Then this one gets active, and this one gets its blood supply back. Then this one gets active. Then it's something the cerebellum does for us. But when you have spasm, that doesn't occur. They all contract at once. And the lactic acid builds up, which makes them contract even more, which means even less blood gets in. The lactic acid builds up even more, and it gets even tighter, and you're off in this vicious cycle. Yoga is probably the best known way to combat this, because you stretch the muscle. And when you stretch it, the capillaries open up, carry away the lactic acid, bring up the oxygen that was in deficit, and you're out of the woods. So I just wanted to answer that one first. When it comes to chiropractic, I know a couple brilliant chiropractors. There's a woman in New York, Karen Anderson, who's a wonderful chiropractor for several reasons. She knows what she knows, and she knows what she doesn't know. I know one on the West Coast who's like a miraculous healer in Los Angeles. And I know several that I really respect and admire. But in the main, I do not admire them. I find that they cause an awful lot of pain, because in a genuine effort to heal you, they go beyond what they know. I looked at their curriculum some years ago. They don't know very much. They're not taught very much. They can learn on their own the way we all can. And some I know do, but they only learn, they're only really taught the spine. So they're not good at helping problems of digestion. They're not good at some muscles that are not part of the spine, like the piriformis. Their means are very limited. So I'm not keen on them in general. I think you're much better off seeing a general practitioner, a family practitioner, an orthopedic surgeon, a sports medicine doctor, a good physical therapist, or a yoga therapist, rather than a chiropractor. I actually had a patient once. She was a model. She was beautiful. She had a very long neck, and that was her problem. And she waltzed into my office with La Belle Indifference, and she said, "It's my neck that's been bothering. Hundreds of practitioners have tried, and none have failed, and I doubt you'll succeed." That was her attitude. And I tried, and I tried, and I tried, and I didn't succeed. I failed. And I started reading the books of the bone setters and things like this. And I said, well, I'm not going to experiment with her. This is a delicate woman. So I called a chiropractor for the New York City Ballet, whose wife was in the ballet. So I figured she was keeping him honest. And and we made a deal. I would go to him and volunteer my services because he had some medical needs. And this patient would go see him for free. So it worked out very well. Not only didn't he help her, he taught me a trick. Basically, you go behind the person's back and you go something like this, and they think that they have a cleverer way of doing it, and they think that you're cracking their bones. And then one day, a little girl came in. It was right near Carnegie Hall in New York City. There's a fairly inner city neighborhood right there. And these were minority children who, the only way they're going to go to college is if they get a scholarship, and they're running their little hearts out. They're running as fast and as long and as hard as they can. This was a little girl who was running like heck, and her foot really hurt. And he got an x-ray the way chiropractors often do. And he looked at the x-ray and he said, well, it's the tarsal coalition. I looked at the x-ray. I called him over to the side and I said, isn't that a fracture of the 5th metatarsal? And he went back and looked at the x-ray and he said, honest to God, these are his words. Oh, of course it's a fracture, but the important thing is the coalition of the tarsal. He's going on and on. These words are pouring out of his mouth, and he was completely ignoring what was wrong with her. So it was an example to me of how a little knowledge is a dangerous thing. He didn't learn anything about the foot. They don't teach you that in chiropractic school. So it's a lesson to be wary, be careful if you see them, and ask a lot of questions and tell them how you feel.
Great. I think this is this is just about all the time we have. I know Will has a question as well. Will is among the audience. He wants to know about the back pain. You know, what do you think about back pain and chiropractor? Do you think for back pain chiropractors are good?
Well, I think that's what chiropractic was originally intended to do, is treat back pain. That's what you go into a chiropractor's office. What does he have? He doesn't have a skull. He has a backbone, and that's basic, or she, and that's what they do. And so, as I say, sometimes they're brilliant. They are, and almost magical. They do a very little thing and they get better. But I've not had spectacular results. I haven't even had good results. I've had bad results. It's just my experience. But they claim to cure scoliosis, and I've had many patients who say, Dr. Fishman, I'm not going to use your method. I'm going off to this chiropractic seminar for a week in Connecticut or in Colorado, and they come back and they're worse. They're not just the way they were before. They're worse. There's the Pettibone method. There's the clear method. There are a number of methods the chiropractors use. I think you're much better off with a yoga therapist. If you see a chiropractor because somebody in your family has seen him and loves him, keep your eyes and ears and the organ of suspicion open, because in a genuine effort to do you good, sometimes they do you harm. A little knowledge is a dangerous thing.
Great. Thank you so much, Loren, for sharing your wisdom and your stories with us. Always a pleasure to have you and hear your stories. I hope everybody had as much fun as I had, and hearing, I just want to kind of preserve as much of this as I can, because I always love spending time with you, Loren.
Well,
thank you.
Pleasure. You're a great interlocutor. You're a good interviewer. So take care, everybody. And you can always write to me if you care to. Loren, Loren, at sciatica, which you probably know how to spell, .org, O-R-G. And I'll do my best to answer your questions as soon as I can. I always answer everybody.